ability to look at plans side by side, see what the coverage options are, and to know that companies have to compete for Savannah and Chris based on price and service. They can't compete based on who can lock out people who will get sick, because no one will be able to be locked out because of a pre-existing condition. Everyone has to follow the same rules about spending 80 cents of every health premium collected on health benefits, not on overhead and CEO salaries. They can't any longer put a cap on people's and lifetime benefits. Starting in January, there will be a very clear out-of-pocket cost limitation. I was with a nurse in Pittsburgh recently who she and her husband thought that they were fully insured. She thought they were in great shape until they had a baby with a condition much like you described your brother's having, a congenital heart defect. After his 4th surgery, and they had drained their family income with out-of-pocket costs, they drained then their extended family income, and then they began putting their out-of-pocket costs on a credit card, and it drove them into family bankruptcy. The good news is her son is healthy and well, but their credit history will never be the same. And she said nobody should have to go bankrupt because you get sick, and again, that won't happen again. So healthcare.gov is great. But there are a lot of people who, and I know you'll see them, Jody and Michelle, you will see them all the time, and Melanie, who need someone to actually walk them through the process, need questions answered. So coming to a local navigator. Or going to a community health center. Every community health center in the country has enrollment and outreach folks, as well as people who are trained navigators. And the third option is the call center. 1-800-318-2596 is the number. It's open 24 hours a day, 7 days a week. Available translators to answer questions in up to 150 languages. And if someone wants to, they can actually enroll online. A navigator, a call center representative will actually walk them through the entire process, tell them what they're eligible for, and can get them signed up. So you can go on the web, healthcare.gov, you can go to the call center, or go in person, or do a little of everything. Go on the web and check it out, and then go find a local navigator to help answer questions. So we've tried to anticipate different ways that people may need help, and getting help in a culturally competent, language competent fashion.
So will going to the site, will folks be able to get information about the financial help that they're eligible for as well?
Well, that's one of the interesting things about the website. And again, I don't know that this has ever been put together before. What we know is about 80% of uninsured and eligible Americans will qualify for financial help. And that's families who earn less than about $94,000 a year, or an individual who earns less than $16,000 a year will have, starting at $16,000 a year, and up to $94,000 a year. They will have a accelerated tax credit available to them. So since an employer doesn't pay a share of health coverage, the federal government is actually helping to pay a share of insurance coverage, knowing that it's better to have everybody insured and everybody in the pool. And as you come through the website by entering information about who you are and what your family income is, you will automatically then be told what you qualify for in terms of financial help. And indeed, when you pull up the plans in the marketplace, that will be calculated into the premium that you pay. So you don't have to try and figure out what it is that you will owe each month. You can actually have the calculation done automatically as part of looking at the plan qualifications, and it will automatically become part of your purchase of the plan. So that's kind of built into the system from the outset.
So I have another question. What should we be saying to young people? Why do you think this health law matters to young people?
I think that the health law is important to young people because a lot of young people don't realize that, even though they're incredibly healthy and they keep active and they eat well and they do the right things, accidents happen. And young people are the most likely to have some sort of accident that leads to a very expensive and costly health bills. So, having that really simple, affordable, basic plan is gonna prevent you from getting into those enormous debts that you can acquire from being a young person that gets into a car accident or falls down the stairs. So.
Well, I'd also say, Judy, that in addition to people who may get into an accident, and again, that's falling on a basketball court, getting hit in a rugby game, having a spill, a car accident, God forbid, or getting hit on your motorcycle, that's always a possibility that you can't pick and choose. But the other piece of health benefits that I think people and young people may not think about so much, but is critical, is preventive care and preventive screening. So getting a regular health checkup. If there is anything that's going to go wrong, identifying it as early as possible, and then having, and Chris talked about this, having an ability to do something about it. I can't tell you the number of people I talked to who said, I don't get a mammogram because even if I got a mammogram and found out something was wrong, I don't have any way to pay for the follow-up surgery. I don't have any way to take care of the chemotherapy, and all it would do is terrify me, so I just don't get it at all. Well, those days are over because the new health law requires that all the plans have preventive care, but have it without copays and co-insurance, knowing that it's better to get the early checkup. There are a whole set of preventive care benefits, as the mayor knows, from dealing with Kathy, his wife, that deal with women's health care, that have never been part of insurance policies, everything from contraceptive coverage to prenatal care and help for young nursing mothers, mental health screening.